Although there are several ongoing clinical trials in Rett syndrome, and some of them are very promising, we can talk about that later if you like. But currently, there are no specific FDA approved disease modifying treatments for Rett yet that have been approved by the FDA. And so, until there's a cure for Rett, parents and clinicians really must continue to work together to treat this disease using symptomatic approaches. As I mentioned, Rett syndrome is a multi-system disorder that requires, a multidisciplinary management, across a team of different medical experts in different specialties. And so, for example, some of the treatments include um, anti-epileptic drugs to control seizures, or selective serotonin reuptake inhibitors for anxiety, nutritional management to maintain caloric intake and vitamin D levels, um, you know, different treatments for the gastrointestinal complications and the sleep problems, and physical therapy to improve motor function are some of the approaches that are taken. And, it's interesting, a recent environmental enrichment clinical trial, which consisted of motor learning and exercise combined with social, cognitive, and sensory enrichment, actually showed some improvements in motor function in Rett with girls. So, these kinds of symptomatic treatments can really, help these girls. Um, and I will mention that many of the Rett syndrome foundations, for example, the International Rett Syndrome Foundation and the Rett Syndrome Research Trust, include lists of specialized Rett syndrome clinics across the US that are available to consult and or manage individuals with Rett syndrome. And I think it's pretty recognized that with appropriate symptom directed care, people with Rett syndrome can live long and meaningful lives. And the parents and the families play such an important role in, managing and carrying out the care of these girls.